Governor Mark Dayton's third day in office deepened Minnesota's participation in the federal health care overhaul. Dayton signed an executive order that will expand the Medicaid program for vulnerable adults. The Democratic governor was both booed by protesters and cheered by supporters today. News intern Brian Legal explains how Dayton welcomes federal funds for health coverage for those in need and reversed Palente's anti-Obamacare stance.
It was standing room only as the governor signed an executive order to increase medical aid to about 95,000 more Minnesotans. This is a move that will help medical facilities continue to offer their services to lower-income patients.
What it's going to do in our district, make funds available to small hospitals so that they can get reimbursed for patients they take care of.
The federal aid that Dayton requested will also bring federal tax dollars back into Minnesota. Money from Medicaid will likely help organizations such as North Country Health Services provide more services in the future.
We've been seeing over 100 patients a month that are in the general assistance medical care. A lot of them in our emergency department because they could not seek care elsewhere.
The aid is also expected to help healthcare organizations reduce the losses that they encounter for providing services that were previously not covered.
Between about $250,000 to $300,000 of charges a month that we were having to basically write off because the program did not really provide any funding for those services.
As medical assistance increases for lower-income families, it will also benefit the cost of health care for other Minnesotans.
The primary focus is going to be that's going to help keep our health care costs down.
Even though the assistance can help keep the cost of health care down, there are still many opponents who showed up to protest Dayton's order. Brian Legal, Lakeland News.
The Medicaid expansion will funnel more than $1 billion to medical providers while covering 12,000 uninsured adults and improving coverage for tens of thousands more. Republicans are wary because it requires additional general fund dollars in a time of deficits.